Hi everyone, this presentation covers Chapter 11, Dissemination, in the textbook Big Data for Epidemiology, Applied Data Analysis Using National Health Surveys. This includes Part 2, covering manuscripts. Here's an outline of Chapter 11. In the last presentation, Part 1, I discussed Section 11.1, Introduction, Section 11.2, Abstracts, and Section 11.3, Presentations. In this section, I will cover Section 11.4, Manuscripts, Section 11.5 on Writing Tips and Tricks, Section 11.6 on Summary, and Section 11.7, which includes some references. Section 11.4, Manuscripts. Writing a manuscript is the final step in the research process. Although it may be scary to some people, writing manuscripts is really a teachable skill. So scientific writing is formulaic. There's a specific set of steps that you can follow in order to write. It is short, concise, and includes very simple sentences and simple prose where talent is not very important. This differs from creative writing, which is usually not formulaic. It can be any length, and it's not usually very concise. The sentences can be complex, and there's very complex prose, and actually talent is pretty important. So we, in scientific writing, can follow a recipe. We can follow a specific format on how writing should take place. So here are 5 principles of scientific writing. Scientific writing should be clear. Things should be written in plain English, and it should be simple. It should be concise, using as few words as possible. It should be exact, so what you're reporting on should be accurate, and it should be authentic and trueness to form. Section 11.4, Manuscripts. When you're writing a manuscript, you want to make sure that you adhere to the word counts, referencing, and other specific guidelines for a journal. So whenever you're writing a manuscript, you want to pick out the journal that you want to submit it to. Within that journal, they will have specific guidelines for you on how to write it. So they may say you need to follow the American Psychological Association, or APA, or American Medical Association, or AMA format when writing papers. The formats differ depending on the type of research manuscript you are submitting. So an original research manuscript is the most common, and that's typically about 3,000 to 5,000 words. That includes all details of the background, the methods, results, and discussion section. However, you may also write a brief report. Sometimes a brief report is just as good as an original research manuscript because it takes a lot of the fluff out. It takes a lot of the additional information that may not be needed, and it's also good for small studies. So you may find that when using national data, a brief report might be a little too short because there's a lot of additional information that's needed. Or if, say, you're writing a second paper and you've already published one original research manuscript, you may be able to submit that second paper as a brief report in a shorter version. You can also submit letters to the editor, which include research findings, and these are about 500 words. I've had some articles where I've submitted in the past, and I've submitted either a brief report or original manuscript, and I received a rejection but was asked to write it in a letter. And then I had to take this 3,000 word submission and cut it down to 500 words. Different journals may have different guidelines on blinding as well, so they want to make sure that the bias is removed in the review process. So they may ask that you remove all names from the manuscript, and also any way to identify that your previous research led up to the study. So if I'm doing a study that uses a method previously published, I don't want to put my name here. You just want to say that it's previously been done before, because then they can't really tell if you did the previous research study or you're modifying it from someone else. And so you really want to tailor the way that you write to a journal style, and I think this is very important. When I was taught to write before a lot of times they say, okay, we'll just start off with the introduction, do the lit review, write this long introduction, then you go and you do your methods and the results, and the introduction has nothing to do with the main finding. And so I just find that to be not a very good use of time to start off writing in that way. Also, some people will say, oh, we'll just write it and then later on we'll fix it to the journal style. I think it's very important to start off with having a journal in mind, and then if that journal does not like your study, then you can revise it later, but start off with a set journal in mind. And so based on the journal style, you may be writing in an active or a passive voice. You want to include some simple sentences, simple words. They may want things like the subject up front. Instead of saying the data were collected by, you would say we collected the data. Another thing that you want to do when you're writing, just a tip, is to include topic sentences in each of your different paragraphs. You can also use planned repetition. So I do that a lot within my discussion sections, where I will say the first main finding was blank, and then the second main finding was blank. And because you want to make it as simple as possible for whoever is reading your paper to understand what you're trying to portray. Another tip that some people have is to use no adverbs. So I worked with someone in the past who did not like ly words, and whenever we would go through a grant process, she would go through and cut them all out. And so sometimes, you know, it's needed for flow, and other times it's just not needed. So she would just cut them all out. And use past tense. So when you're writing a journal article or any manuscript, you always want to use past tense because you've already done it. So section 11.4.1 covers the manuscript sections. So when you submit a manuscript, you usually have a title page. This is either blinded or unblinded. Some journals want you to have both. And include an abstract and some keywords, so they should provide some guidance on how they want you to write the abstract and the keywords, the number of words, etc. And then you have these different sections, and these sections align with the steps of scientific discovery. So your introduction really is focusing on identifying the research question, and your methods focuses on selecting the study approach and designing and collecting the data. The results includes information that came from analyzing the results, and then your discussion is a reporting of the findings, the interpretation of the findings. These subsections, or these sections, typically have subheadings, and this can also be very specific to the journal that you submit to. So you may include a literature review in the introduction. You may include variables in the methods section. In your results section, you may have different paragraphs for, say, bivariate results or demographic characteristics, and then a section on multivariable regression modeling. And you may have a strengths and limitations section in the discussion. This is very common. A lot of the times, almost 99% of the time, there is something that says in the author guidelines that you need to include a strengths and limitations section. And so when writing manuscripts, there are often checklists available that you can use. So these checklists are standard, internationally recognized and used for reporting research articles, and they are created in order to have some sort of standardized way that people write. Journals have all of these different ways that they want you to write things, and sometimes I just am like, why do they not all have it the same way? Why do they not all have the same citation format? It would make everyone's life easier. And so here are some examples of the different study designs and the checklists affiliated with it. So for an observational study design, so being cross-sectional, case control, or cohort, the checklist that you would use is a Strobe checklist. For a randomized clinical trial, you would use the consort statement. For systematic reviews and meta-analyses, you can use the PRISMA checklist. And these checklists are available free for anybody online. You can just Google them. And they're very helpful when writing because you can think about the different areas where your reviewer might be using one of these checklists to look at your article and critically appraise it to decide whether or not they're going to publish it. So section 11.4.1 talks about abstracts in manuscripts. And so an abstract is a brief summary of the article, and some people say it's the most important part of the research article. So this is the first thing that the readers see prior to accessing and reading the full articles. They're free to anybody online. However, they may need to pay for a full text article or go through a library site or request it from you personally. I have received several messages weekly requesting full text articles on, say, ResearchGate or other social media platforms, whereas an abstract is free. So you want to make sure it includes the most important findings that are relevant to the study. So two strategies when writing your abstract that can be used is you can write it before the manuscript as an outline, or you can write it at the end and take key points from the completed sections. I've done both ways. Usually I do the second way, where I write it at the end. However, I recently started working on a study, and because it's one of the second studies that I'm doing where I've already written the methods but had a different outcome, I found it harder to start actually writing the paper first. And so I've used my abstract that's been submitted to a conference as an outline to start to fill it in. And so when you do write your abstract, particularly if you write it at the beginning or write it at the end, or even if you say submit it to a journal and they ask you to make changes, you want to make sure that there's consistency between the abstract and text. So I read of a recent study where they talked about looking at abstracts and full text of the articles, and sometimes the results don't match because maybe the abstract was submitted with the article prior to peer review, then changes were requested, and then the manuscript was changed, but the abstract wasn't. So you want to always make sure that there's consistency between the two. Section 11.4.1b is on the introduction. So the introduction is the format that is shaped like either a funnel, or you could call it an inverted pyramid as a framework. And so this picture here is of the Louvre. There is a large pyramid. If you've ever been to the Louvre in France, you know what I'm talking about. It's in Paris. But outside there is one very large pyramid, and then underneath the large pyramid outside there's an inverted pyramid underneath. And so it's a good way of thinking about the introduction because it starts off with a lot of people and a very broad context that is seen by everybody. And then when you get down to the basement and you going into the museum underneath, that it gets narrower and narrower and narrower. There's fewer and fewer people down there. And so an introduction really describes the importance and the rationale of the study from a very broad perspective, and then it narrows it down to the specific aims. So figure 11.4 shows an overview of an introduction section sort of created using this pyramid as a model for writing manuscripts using national health surveys. So the first section focuses on the broad context, morbidity, mortality, and health services use. Then the second section focuses on social determinants of health. The third section focuses on identification of an exposure. Fourth section is the gap in the literature, and the fifth section are the aims. So starting off with the first paragraph. So this paragraph will conceptualize the outcome or the dependent variable. So it starts very broadly to talk about the morbidity, mortality, and health services use. You are conceptualizing why it's important. And so an example may be, what is the morbidity and mortality of, say, Alzheimer's disease as our outcome. And so you may say that over 6 million individuals have Alzheimer's disease and related dementias, or ADRD, in the United States. And one of the reasons why this is really important is that treatment is costing over $350 million per year and continuing to increase. Then the second paragraph focuses on the social determinants of health, and this is particularly true when doing studies in public health looking at race and ethnicity. My research focus includes race and ethnicity as a predisposing factor of morbidity, mortality, and health services. And so here you're really narrowing down that context a little bit. And so, for example, you're taking ADRD as an outcome, then you may be wanting to look at the prevalence of ADRD among non-Hispanic Black individuals compared to non-Hispanic white individuals. Then that third paragraph could be combined with the second paragraph, particularly if that's your main focus. And so here you're really focusing on the exposure, and it could be that you really want to know what research has already been conducted on the relationship between the exposure and the outcome. So using ADRD as an example, we may want to examine how ADRD prevalence differs among U.S. and foreign-born racial and ethnic minority groups, because previous studies have shown that foreign-born individuals tend to be healthier. They tend to have better health outcomes than those who are U.S. born. Then that fourth paragraph and the fifth paragraph may be combined unless that there is a really large gap in the literature that you want to focus on and explain the importance of filling that gap. So the fourth paragraph is the gap in the literature on that relationship between the exposure and the outcome. And then the fifth paragraph is looking at really specifying those aims and the objectives. And this could also include, depending on the journal, depending on the study design, research questions or specific hypotheses. So section 11.4.1c is the methods. And so within the methods section, you want to discuss how you conducted the study and why you conducted the study in a particular way. You want to provide enough information so that if someone wanted to replicate your study, they could do that. And this is particularly important for National Health Interview Survey and other national health surveys, because anybody can go and download the data from the website and they can run an analysis and get different results and potentially question your results. And so you want to make sure that you're very specific on how you create your variables. Within the methods section, there are several different subsections. So you could have a section on data source, participants, variables, statistical analysis, and IRB approval. And I will go through each of these sections in the next set of slides. So some of the tips for this are to use past tense. So everything has already been conducted. So always remember when writing your paper, you use the past tense, particularly methods and results. And you can write in the active or passive voice depending on the journal. So active voice, we collected the data, whereas a passive voice says the data were collected. So in the data source subsection, this is where you want to specify the National Health Survey that was used. And here you would specify the years or the panels included within the survey that you use when you combine them. You want to include some brief details on the history and purpose of the survey, but since it's already been published before, you can refer the reader to the website and previous studies using similar methods if you previously published them. If you used a method that you used before, you want to make it indicate that you are using a previous method, but to keep it blinded, which a lot of journals want, you want to refer to yourself by name as the researcher who published it before and not say our previous study did this, which I've done a lot in the past, which is good for grant applications, but not good for manuscripts. In the participants section, Here's where you want to include a total number of participants who completed the overall survey and then start to limit it down based on your predetermined inclusion and exclusion criteria. It's good to include the unweighted as well as the weighted participants in the sample. I know some people that just put the unweighted and then say, well, if they want to know the weighted version, they'll ask us in the review process. And this can be represented by a figure. So here is an example looking at disparities in chronic disease prevalence among U.S.-born whites, European American whites, and Arab American whites. And here you can see it starts off with this total number of participants in the National Health Interview Survey. Then it includes the family file, the household file, and then the inclusion together, and then the separation of the groups by U.S. and foreign-born non-Hispanic white groupings. In the variables subsection, you can include details on the questions used to meet the study aims. So you often want to include the full question that was presented in the survey and then reference it. Within that section, you may have some other subsections. So you could include an independent variable section. These are our exposures or the predictor variables looking at, and the dependent variables. These are the disease or outcomes, and then the covariates. And so covariates could include confounders, mediators, and other explanatory factors. These are the factors that you're controlling for in your multivariable logistic regression models, if you're using those, or other types of adjusted analyses. And so you want to include how you recoded the variables in this section, and if you use some specific methods for removing missing responses, you can include that here. You want to include the references to the previous studies that served as a basis for recoding the variables, or if you chose specific covariates based on a previous study, include that here. So for example, on some of the studies that I'm doing using cognitive limitations, we use a model that was developed by the Lancet Commission that has potentially modifiable risk factors for dementia. And it outlines several different risk factors that I specifically include as my covariates. And so I reference that article each time I include those. In the statistical analysis subsection, you include details on what analyses were conducted to meet the research aims. So these can include the basic statistical procedures such as frequencies, percentages, means, and standard deviations. It can also include the comparative or bivariate statistical procedures, including t-tests or chi-square tests. This could also include the inferential statistics such as regression analyses, and the weighting, clustering, and primary sampling units. You want to include that you've done this, otherwise someone may come back and ask you if you use the appropriate procedures. It's good to cite the analytic guidelines for each specific national health survey within these sections and cite the software that were used. So the next subsection is ethical approval. Almost all journal articles will ask you whether or not your article has been approved by an ethics board. So studies with national health surveys sometimes fall within that gray area of whether or not you need IRB approval. At the University of Texas at Arlington, using public use data from a national health survey does not require IRB approval. And within the NIH, if you use the decision tool, which I have the link for here for you, it tells you that you are not doing human subjects research if you fill it out and show that you are using data that are publicly available and do not identify participants. That does not mean that you do not need to use standardized research methods and you can just download any data and just go publish it anywhere. But you don't have to go through and burden the ethical review board at your institution, potentially. Now, that's not always true for all universities. When I worked at the University of Texas Southwestern Medical Center, they wanted to review studies, even if it was done with publicly available data. And so within the methods section, as well as other sections, you may also include figures. And so these figures could include how the study sample was limited based on the inclusion and exclusion criteria, like the flowchart that I showed on the previous slide on participants. It may also present a theoretical model or some trends and some key findings. So this is a theoretical model that was used for a study that I did with Drs. Brown, Dr. Brannon, and Dr. Boateng. And it is used for looking at patient experiences and how it influences health outcomes such as overall healthcare quality, diabetes self-efficacy, and diabetes care management among non-pregnant women of maternal and child health age, maternal age being from about 18 to 45 years. Section 11.4.1d covers the results. So the results may be considered the heart or the most important section of the paper. It highlights the researcher's contribution to scientific knowledge and general knowledge. It should directly align with the objectives and hypotheses presented in the introduction, the methods outlined to meet those objectives in the methods section, and the comparison to the studies in the discussion section. So I always say you need to have a specific objective, a specific method to reach that objective, and a specific result. And then, what is the interpretation of the results, and what is the backup to why you are doing that as an objective? In the results section, you are presenting the main findings, but you are not interpreting them. So you do not take those findings and compare them to other literature until you get to the discussion section. The results should include a mixture of tables and sometimes figures and text. So I will include some table shells in the coming slides as examples of how you can present your data. It includes all findings obtained while conducting the research study. And there's usually about one paragraph for each table. And you need to make sure that you refer to the tables within the text. You can use headings that are similar to the table titles in order to direct the reader from the text to the tables more easily. Some journals may also want you to include a placeholder, so after you talk about Table 1, all of the information that's in Table 1 or less detail about information in Table 1, and then you would include in parentheses, insert Table 1 here, so they know where you plan to have that table. Typically you have at least 2 tables, and these tables are presented with increasing complexity. So Table 1 is almost always the demographic table, and then Table 2 onward includes your main analytic results. And each table should stand alone with specific titles and footnotes to describe its contents. So you should be able to look at the table and look at the results and know what it is without having to read any more of the text. So Table 11.3.2 is a table shell representing how to present basic sample characteristics. And so I have many students do activities like this in my lab where I create table shells and then I ask them to read outputs of data and enter the results within the table shell. So it could be that I just want to say how many people are in my sample and what are the differences by sex. And so I could include a column that has N, which is the number or the frequency, and the percent of people within each of the groups. Then I might also want to include the weighted numbers. So since the foreign-born Arab Americans category in my research studies is often very small, it may be good to show the weighted number, because then I can show that, yeah, it may only be 400 people in the sample, but when you weight that, that's representing thousands, maybe 100,000 of people. And so sometimes it's good to show that. Then Table 11.3.b is a table shell representing ways to present bivariate analyses using the sample characteristics. So instead of coming out and just saying the sample size, we may actually include our outcome. So if our outcome is to look at flu vaccine uptake in the past 12 months and look at comparisons by race, ethnicity, and nativity status, then we could take those columns and then separate them out by those who did have a flu vaccine and didn't have the flu vaccine, and then include the p-value from our chi-square test results, which is our bivariate analyses showing comparisons between the two variables. Then table 11.3.c shows a table shell for an age and sex-adjusted prevalence estimate. So it could be that we wanted to adjust for those variables using a predicted marginal statement. And so instead of saying that 11% of adults have Alzheimer's disease and related dementia, we could say that after adjusting for age and sex, that result is even higher or lower. Then table 11.3.d is a table shell for logistic regression results. So here's an example of presenting odds ratios and 95% confidence intervals for our multivariable analyses. And so if we're looking at flu vaccine as an example here as well, and we wanted to look at foreign-born Arab Americans, we could compare them to U.S.-born non-Hispanic whites, and in a regression analysis we would get an odds ratio. The crude result would be an unadjusted result. Then our second model could be something adjusted for, say, just age and sex. And then our fully adjusted model could adjust for all the different risk factors that we want to include there. So within the results section, you may also have a subsection called the sensitivity analysis. This is not always required, but I find it increasingly common among reviewers to request that a sensitivity analysis be done. And what that request means is to take a different model or set of assumptions, apply it to your analysis to try and get similar results. So an example of this includes some of the studies that I did looking at Arab Americans, but looking at it categorized in different ways. So my colleague and I did 4 studies where we looked at restricted data from individuals born in 15 countries geographically located in the Middle East and part of the Arab League of Nations. So we created that variable as a foreign-born Arab American, and that was restricted data in order to do that. However, if I wanted to use the public use data, I could just use the variable that has individuals born in the Middle East. Or it could be that I also want to include North African white individuals, because that is also a publicly available data. So what I could do is I could take my original results, and I'm planning on doing this for a study, currently in the process of working on this, but conducting a sensitivity analysis to show that we don't actually need the restricted data, that the actual public use data is still representative of the restricted data. The results are similar between the two. And so typically when you take a sensitivity analysis, you will include that in supplementary material. I've also done some sensitivity analyses looking at cancer screenings. And so if my outcome was whether or not someone had a mammogram in the last 1 year, but yet the guideline is that you could actually have a mammogram within the past 2 years. If they didn't have it in the past 1 year, but had it from 1 to 2 years, then they wouldn't be non-compliant. And so you can do different ways to adjust for that there. Section 11.4.1e is the discussion section. So here is our pyramid on top. This is that same period I was discussing at the Louvre, and this is where you start off at this very broad section. You start off with the area which has most people, and then you move up and you get more specific. So the purpose of the discussion is to interpret the findings and provide meaning to the results in the context of the other literature. It mirrors the introduction section as the pyramid of the reverse funnel. So you're starting off at the top as this is what the study aim was, and then once you get to the bottom, you're able to talk about the broader context there. So the first paragraph is the purpose or the main findings. Then the second paragraph or the second section, because it can be more than one paragraph, compares the results to the existing literature. Then the third section includes the strengths and limitations, and the fourth is the conclusions and implications. So the first paragraph, so here we're not starting at the bottom where all the people are, we're starting at the top. We have restatement of the purpose and briefly summarize the main findings. So my discussion section almost always starts off with the purpose of the study was to, and we found blank. I sometimes reword that, and usually people that I work with may say, oh no, I think we should reword this, but when I'm writing my first draft, that's typically what it says. Then that second section includes at least one paragraph discussing the relevant findings. So I may say the first main finding that we found was blank, and then you can compare and contrast it to other previous studies. Why you got the same results as other studies, and why you may have different results than other studies. Then the third paragraph or section talks about the strengths and limitations. So some example strengths of national health surveys include that the studies are usually using some sort of probability-based sample design versus a convenience sample. You're not just standing outside a grocery store asking everybody who comes in to fill out your survey. You are actually going through, picking out zip codes based on counties, based on census tracts, based on states, and strategically, mathematically coming up with ways to find out who to survey. Another strength could be a large sample size and a broad content area. So you have many questions that are asked usually in these national surveys that you can use to adjust for in your analyses if they're not your main exposure and outcome. Then some limitations include a cross-sectional design. Not all studies are cross-sectional, but many are when they're using a national health survey. And information bias with the self-reported data collection mode. So you may ask somebody something and they may not know exactly the result. You may ask them about their diet in the last week and they may not remember what they ate unless they eat the same thing all the time. You might ask them about whether or not they've had a flu shot in the last year, and they may not remember if it was the last year. It may have been 2 years ago. Then the fourth paragraph or section is the conclusion section. So here is the broad part at the bottom. This is the generalizability. So you take the impact of the findings that you may have on different interventions and public health policies. So where are your results important? And so this includes that take-home message with the results and of future directions and recommendations. So section 11.5 includes some writing tips and tricks. So these are some tips that I have when I'm writing. Start with the results section and then write the methods section. I used to say start with the methods, then the results, and now I like to write the results first. I like to create my tables and figures first and then write 1 to 2 sentences about them, and then I can usually start writing more after that. That way I can frame my introduction and discussion about the key findings, and I don't have a lot of extraneous information in the introduction that I'm not going to use. Another tip is to select a similar article to use as a model for writing. So I like to look at the journal article that I select, the journal, to see if it has an article published on the data source and if it's a similar topic, and then I can see how they've reviewed it and how things have been written for that journal. You don't copy it, you don't plagiarize it, you just look at it as a model. And if you wrote a grant proposal or an IRB protocol, you can use the same information to start writing your paper. In the grant proposal or IRB protocol, you are using future tense because you haven't done it before. So you take that future tense, such as we will analyze, and then reframe it to adjust it to past tense to say something like we analyzed. Then confirm authorship with the International Committee on Medical Journal Educators, or ICJME guidelines. And these guidelines are available to particularly students, early career investigators who may not be as familiar of whether or not they should be an author or who to include as an author. And if you do have co-authors, make sure they're contributing and don't include them if they're not, because you don't need to do everything yourself. Although I like to sometimes, but I shouldn't. Use a referencing software like EndNote or Zotero to manage your in-text citations and references at the end of the paper. And when all else fails, handwrite your manuscript on a piece of paper. Do not type it. Get away from the computer, go somewhere else, go to a coffee shop, go anywhere. A different setting, and just the act of writing something out may make it flow better and enhance your creativity in a very scientific way, but remove those blocks with writer's block. So section 11.6, summary. So in summary, chapter 11 provided an in-depth overview of disseminating research by presentation and publication. So part 1 covered presentations, and this section, part 2, covered manuscripts. Dissemination is the final step in the research process and is essential when conducting research using national health surveys. Several examples have been provided to demonstrate different types of presentations created in sections of manuscripts written by the primary author of this textbook. So many more examples are available, including training videos and resources are on the lab website for the textbook. So section 11 includes some references here along with the next slide. So that is it on Chapter 11, Dissemination, Part 2, Manuscripts, in the textbook Big Data for Epidemiology, Applied Data Analysis Using National Health Surveys. Thank you for listening.